I'm ready.
Oh, it's going?
Yeah.
Alright. Assisted suicide. A touchy subject that no one wants to deal with. Having to choose between taking your life or saving your life, the answer should be obvious. But for some, it's not. People claim that taking someone's life is immoral or unethical. But what could be more unethical than leaving someone to deal with their pain and knowing that they only have weeks, maybe even only days left to live? For many people, assisted suicide becomes the final option. A Morgan poll done in Australia showed that 78% of Australians agreed that a dignified death through assisted suicide would be better than waiting for the death to come. A physician by the name of Robert Perlman, who specializes in geriatric care at the Seattle Veterans Healthcare Center, did an in-depth interview with 56 different cancer patients. The results were published in the Journal of Clinical Ethics that said 96% of them felt that it would be worse to be kept alive knowing there was no hope to prevent the death. 82% of them felt that losing their independence and having to rely on help from someone else would be worse than death. 73% said that they'd rather be dead than have to deal with the pain. Assisted suicide would only be available to terminally ill people who have very little time to live. Now, people may bring up that terminally ill people may just be suffering from a poor mental state of health, but luckily, the affirmative science plan covers this. People who apply for assisted suicide will be required to take a psychiatric test. Psychological tests offer a way to measure someone's feelings, traits, and problems. They also assess conditions such as depression, anxiety, stress levels, and anger control. The next problem is the cost of bringing a psychiatrist to perform a test. The hospital will not have to pay for it. The family who wants the test to be done will be paying. The cost to have the psychiatric test done is only around $175. Of course, another test may be needed to get a definite idea on the patient's mental state of health. But then what about the people who can't afford to pay for the test? That's when the hospital would step in. They pay for the test, and then once everything is done, they add the cost on the final bill, and health insurance will cover it, allowing the family ample time to earn the needed money to pay the X amount of money they owe the insurance company. Now, I understand that the very idea of helping to put someone to death may disgust most people in this room. But when you hear someone is going to die or be put to death, it sounds like it hurt, wouldn't it? But I assure you, the process is kept as painless as possible, and in some cases, no pain may be felt at all. So how exactly would these dignified deaths be carried out? Well, the way we suggest will be from overdosing on pills. This is the preferred method that many choose. By using combination of pills, such as sleeping pills, which carries the active agent Nembutal, with something like antiemetics would cause a painless death. Reliability of the method is very high. An assisted suicide group called Dignitious reported using this method on over 840 people, and reported not one single failure. Fatality rate, 100%. Another method would include adding the drugs into alcoholic beverages such as in a cocktail. It puts the patient into a state of confusion so they don't feel the pain. Now, I'd like everyone to consider something though, that maybe the pain isn't just all on one person. Not just because of the cost or the family's burden to have to take care of the person, but the emotional side to it all. To be honest, I was in a situation concerning assisted suicide myself. I was 12 at the time. My Uncle Malcolm was suffering from hepatitis C. If only I could put into words what I felt the last time I saw him. When he looked at me, I thought to myself, that's not my uncle anymore. I couldn't accept what I saw. I waited outside his room knowing his life was going to end soon. I just couldn't go in. When Dad came out, he muttered to himself, if only I could have given him what he wanted. If only I could have pulled the plug.